Good morning. So my first topic is on the early stage of pregnancy, stage of embryology, and all the malformations that we can see in the before 10 weeks of pregnancy. First, when is it possible to see the gestational sac? So at the really early stage of pregnancy, we can see here the gestational sac during the 5th week from last period. And with the beta HCG, at 500 you can see the gestational sac. If you have 1000, you have to see the gestational sac. If you don't see the gestational sac with 1000, that means there is a problem, maybe an ectopic pregnancy. Embryologists, they use the gestational age from fertilization. And obstetrician, they use gestational age from last period. And I will use this one. And this is a problem because sometimes in some book you can see embryo of 8 weeks in embryology books, but that means it's 10 weeks from last period. So you always have to consider the gestational age to know if it's from LMP or if it is from the fertilization, and also just look at the length of the embryo. Now, I will show you an overview of the normal embryo, because if you want to find abnormalities in the first trimester of the pregnancy, first you have to know the normal aspect. This is at 6 weeks of pregnancy. You can see this is a yolk sac, the embryo with a heartbeat. This is with 3D, the yolk sac, the embryo. And this is another one, but few days later, that means it's 6.5 weeks, you can clearly see now the embryo. And also around the embryo, this membrane, this is the amnion. This is not the amniotic fluid, this is the extraembryonic cellum. If you want to do measurement of the gestational sac in the early stage of pregnancy, I never use it because, in my opinion, it's not useful. You can see these 3 gestational sac. Which one is the biggest? Maybe this one, but not because it's only the same gestational sac in 3 orthogonal planes. So the size depends on the section. A gestational sac is not a sphere. It's flat, like this. So it depends if you do this measurement or if you do this one or this one is completely different. Here it's a twin pregnancy, dichorionic twins, and you have the different rendering. First, this is 2D, this is 3D. To obtain this, we cut here the 2 gestational sac, and we look from here, and you have the 2 gestational sac with the 2 embryo. And this is made with a sonoembryology. Sonoembryology is a software to do the count and to do the rendering of all the follicles in the ovary, but we can use it for all the liquid part. Now we move to 7 weeks with the embryo, the limbs, the yolk sac, the vitelline duct going to the umbilical cord. And this is a mid-sagittal view of this embryo, and you can see the head is beating because this is the heartbeat transmits the movement to the head. This is normal at this stage of pregnancy. If you do this section, this coronal view, the heart is here. And on the axial view, this is the axial view, this is the posterior part of the embryo, this part, and this is the heart. That means at 7 weeks, the heart is outside of the embryo, mainly is outside, and it's quite large compared to the thorax. And on this animation, you will see the position of the heart. And also the heart will move during the first week of pregnancy from this position to this position, and at the end, that means at 10 weeks of pregnancy, the final position is at the level of the thorax 4. 7.5 weeks, Now it's only 13 millimeter. The back, the limbs, umbilical cord. Now we move to 8 weeks. The spine, the heart, the limbs, a black part inside the brain. This is normal. It's a brain cavity. Sagittal view with the brain vesicles, the brain cavities, the developing brain, and this is normal. If you don't see this, maybe there is a problem. Pericardial effusion, this is normal at this stage of pregnancy. It will disappear around 9 weeks. The heart. And on the heart, we can compare to this with the 2 ventricles here. The 2 atria, at this stage, the 2 atria are large here. And this was one with 20 millimeters. That means it's 8 weeks and 5 days, and this one was 9 weeks and 2 days. You can see the 2 ventricles and the septum here. At this stage of pregnancy, 9 weeks, the heart is finished. Brain vesicle, brain cavities, we can recognize the difference. So the biggest one is the posterior one, is the rhombencephalon. This is the mesencephalon, the diencephalon. And on the anterior part, this is a prosencephalon with the 2 lateral ventricles. And this is a rendering using the sonoembryology with the rhombencephalon, the mesencephalon, the diencephalon is here, and the prosencephalon with the division of the 2 lateral ventricles. 9 weeks, umbilical cord, yolk sac. We have no more. Okay. And if you do section, mid-sagittal section, axial section, choroidal section, and here you can see the stomach, the arms with fingers, the legs, and this is the genitalia, but it's not possible at this stage to tell the gender. It's really too early, and you can see the movement and the normal position of the 2 feet, the 2 plantar pedis. 1 foot with the toes, and also at this stage, the sandal gap is normal. You have a large space between the great toes and the other toes. Vascularization with the different parts, ventricule, the umbilical vein, umbilical artery, and the aorta. 9 weeks, the rhombencephal reduce the size, and we have a fold of the rhombencephal. This one will give the 4th ventricle. This is the mesencephal, the diencephal, and on the anterior part, the prosencephal gives the 2 lateral ventricles with the choroid plexus inside. And this is the position of this brain cavity inside the embryo, and you can compare between 8 weeks and 9 weeks. What about the heartbeat? In the embryonic stage, the heartbeat is really stable. So if you look at this curve, and the maximum of the heartbeat is always during week 9. That means it's maximum to 180. And this is normal, and after it will reduce. We have different parts here. We have the complete gestational sac, extraembryonic cellum, the amniotic cavity, and the embryo. And using different software, we can use a vocal software, we can use sonoembryology. It's possible to do the calculation of the volume of each part. And I did it a few years ago. This is the volume measurement of the complete gestational sac without the trophoblast. Complete gestational sac with the embryo inside. And you can see you have a large dispersion. And this is the volume of the amniotic cavity with the embryo inside. And you have on the embryonic stage, you have a really low dispersion of this volume. What that means? That means if you have a large gestational sac, it's because you have a large extraembryonic cellum. If you have a small gestational sac, it's because you have a small extraembryonic cellum, this part. 10 weeks. So 10 weeks now, it's the end of the embryonic part. And now the embryo is no more an embryo, it's a fetus. We can clearly see the ear, the hands, fingers. This is a top view of the head with a fontanelle. The legs, hands, and the mid-sagittal view. And what is this? This is a midgut hernia. At 10 weeks, this is normal, and this is maximum at 10 weeks of pregnancy. This is the presence of intestine inside the umbilical cord. You have a loop of intestine inside the umbilical cord. This is normal. And here you can see loop of intestine inside the cord. The vitelling duct. The vitelling duct is going from the yolk sac to the intestine. It's connected to the intestine, and it will disappear. But sometimes you have a remain of the vitelling duct, a small part here, and the name of this is Meckel diverticule. Here you have the complete evolution from 7 weeks to 10 weeks of the brain cavity, and with a spatial development of the anterior part with the 2 lateral ventricules. What we have to do the measurement of the embryo. But when we do this, we do the measurement of the greatest length of the embryo. And we call it CRL, but it's not correct because the CRL is this one. But we always use CRL, but doing the measurement of the greatest length. In fact, we have to use this name. And with this, in the early stage, it's possible to give the exactly date of fertilization, plus or minus 3 or 4 days. Now we move to the malformation. You know exactly the aspect of the normal embryo. Now we move to malformation. This was an embryo at 15 millimeter of greatest length. And what is wrong with this embryo? You can see the head is irregular, but also it's not possible to identify the brain cavities here. So this was acrania at 8 weeks of pregnancy. This was a 3D rendering with the brain outside. This is a standard 3D rendering, and since last year, it's possible to apply a new rendering. The name is HD Life. It is this one. And you can see, you can compare with the normal one and this one. The anterior part of the head is open with the two, the prosencephalus is outside of the head. And this was a rendering of the brain cavities of a normal one, and in this case. And this is another case from Rabbi Shawi. It's exactly the same. It's not this one because we did a termination of pregnancy for this one, but maybe it's a German cousin of this one. This lady, this was last year, and this lady was pregnant again at the end of the year. At the same stage, she came, 15 millimeter, no brain cavities, and also you can see something on the back. You will see it here. This is a spine, 3D rendering. So it was another neural tube defect on the posterior part, and this was a scan made at 22 weeks. 22 millimeters, that means 9 weeks. Eight weeks of pregnancy, this lady with previous pregnancy, 2 previous pregnancies, the first one with holoprosencephaly, the second one with twin and trap syndrome with one fetus was acardiac. So I did a scan, And you can see here the anterior part of the head, the forehead is flat here. And it was not possible to identify the prosencephalon. This was a normal one, 3D rendering of a normal one, and this one, no prosencephalon. So at this stage, this was at 9.5 weeks. It was possible to say, yes, something is wrong, but it was 5 years ago. I was not able to tell what was the problem. So I wait until 11 weeks of pregnancy, and you can see here, it was another case of holoprosencephaly. So since this case, now I know how to recognize it in the early stage of pregnancy. I did this scan. It was a normal scan, a normal screening scan, but the gestational sac was a little bit too small compared to the size of the embryo. And this was scanned, the head with the rhombencephalon, but also this is a case of holoprosencephaly. You can see on the anterior part here, you have only one single ventricule. Here with the normal aspect, and this one with the anterior part. But you have to know, because on one picture it's difficult to tell where is the anterior part and the posterior part, but when you move the probe, you know exactly. This was the rhombencephalon, and this is the anterior part. And the 3D rendering, normal one, and this one with only one single frontal ventricule. 8.5 weeks. What is abnormal? Large Yolk sac, and the Yolk sac is not in the correct position, because at 8 weeks, 9 weeks, the Yolk sac is far from the embryo, and the Yolk sac was here, close to the abdomen. And the umbilical cord, this is not a normal position. The normal position of the umbilical cord at this stage is straight here in the front. So at this stage, for me, I was able to tell something is wrong. I don't know what is wrong, but we will see it. I just asked the lady, please come at 10 weeks of pregnancy. She said, no, I want to come at 13 weeks. Okay, 13 weeks. You can see a part of the fetus is developed outside of the amniotic cavity, inside the extraembryonic cellum. So this was a body stalk, and in such a case, you have a really short umbilical cord or sometimes absent of umbilical cord. Another abdominal wall defect at 12 weeks, 13 weeks, here, 3D rendering. But I did only the scan at 13 weeks. But she had a scan at 9 weeks with another doctor. So I called the doctor and tell him, please send me the picture of 9 weeks. And this was a picture of 9 weeks, not really good, but already there was an abnormal anterior wall here at this stage. Hydrothorax, if you do a scan at 8 weeks, 9 weeks of pregnancy, you will see it. Sometimes you have 2 black spots inside the thorax. Sometimes it's really large, and you can see the heart is beating, and this is the position of this hydrothorax. And the prognostic is not good in such a case. Sometimes you do a scan 1 week later, and the embryo is dead. And this was a 3D rendering with a color Doppler, and you can see you have a reverse flow in the main trunk. This is the pulmonary artery and the ductus arteriosus. And for this one, I did a scan a few days after, and the embryo was dead. This is another case, hydrothorax, 8 weeks, and when you have an hydrothorax, you have a large thorax here. And I did a scan at 13 weeks, and something was wrong on the heart. But we did the final diagnosis at 22 weeks, and it was a fallow. So maybe this was a marker, a first mark of something was wrong with the heart. Another case of hydrothorax, 8 weeks, large one. This is a position of the hydrothorax. The checkup at 9 weeks, and you can see eye drops, nuchal translucency, and at 12 weeks, it was increase of nuchal translucency, and it was a Turner syndrome monosomy. Again, another hydrothorax here with abnormal face. And look at this. You can see the heart is not in the correct position. It's a little bit too more outside. And also on the anterior part here, you have holoprosencephaly. This is the same with the 3D rendering. Holoprosencephaly, the heart outside. And if you use a color Doppler, it's only 9 weeks of pregnancy, but you can see here one main trunk. This is the pulmonary artery, and only one inflow. So maybe it was a single ventricle. So what to do when you have hydrothorax in the early stage? I have had 26 cases with deaths of embryo in 15 cases. And one was a triploidy, 2 holoprosencephaly, and one of the holoprosencephaly was termination of pregnancy, because after the diagnostic at 9 weeks of pregnancy, we did termination of pregnancy. And normal evolution 11, but in this we had 3 malformations, 1 holoprosencephaly, 1 fallow, and 1 Turner syndrome. That means if you have a hydrothorax in the early stage, the prognostic is not good. That means more than 60% will die or with malformation. Miscarriage, what we can see in case of miscarriage, the lady is coming, her beginning of pregnancy with bleeding. Sometimes she is at 12 weeks of pregnancy, but you put the probe and you have no embryo inside. That means the pregnancy stopped 1 month ago, more than 1 month ago. This is a blighted ovum. Also, you can see this, irregular and slow heartbeat. And when something is going wrong, also you have a large amniotic cavity. At this stage, the amniotic cavity is not so large. And here, this is a 7-week embryo here, and you have a huge amniotic cavity. Abnormal embryo and yolk sac. The yolk sac there is no division between the embryo and the yolk sac. You can see here the yolk sac, and the heartbeat is beating really, really slowly. This was a premortem, and this one with a small gestational sac. 8 weeks, and the heart is beating slowly and outside, completely outside of the embryo. That means this one was a body stalk. Maybe it was a body stalk. And also, if you look at the head, you cannot see the brain cavity. That means it was acrania. This one at 9 weeks with a slow heartbeat. It was just a premortem. 1 hour after this embryo was dead, it was a twin pregnancy. And this one at 7 weeks of pregnancy, the embryo was here, and this is a heart. It's only a tube, a contractile tube, only one single ventricle or atria, but also this case was just before the death of the embryo. Sometimes you do the scan at 12 weeks of pregnancy. The embryo is dead since 4 weeks, and you have this strange shape of embryo here on 2D, here, with abnormal position of the umbilical cord, with short limbs. And look at this face. And maybe all these cases are holoprosencephaly, because holoprosencephaly is really frequent in the early stage of pregnancy, but they will stop, they will never go over 8 or 9 weeks. I just tried to open all my miscarriage I saw, and you can see I put it before 6 weeks, I have 180 with a measurement, and we have 2 peaks. That means this one and this one and this one. And after, if the embryo is more than 25 millimeter, it's really rare to have a miscarriage. Now, some words on the twins. If you have two eggs, what's happened? You can obtain only a dichorionic twins. If you have only one egg, this is a monozygote, and you can obtain a dichorionic, also monochorionic diamniotic, and monochorionic monoamniotic. And in an early stage, it is really easy to do the diagnostic, especially between dichorionic and monochorionic. 6 weeks, this is a dichorionic. You have 2 gestational sacs, and on each gestational sac, you can see the yolk sac. And this is a monochorionic with 1 gestational sac, 2 embryo, and 2 gestational sac. After, it's more difficult to tell if it will be a monoamniotic or diamniotic, but you will see it later. If you have 2 yolk sacs, that means you will have 2 amniotic cavities. That means it will be a diamniotic. 8 weeks, dichorionic. You can recognize because you can see here this 6 septum between the 2 gestational sacs, and on each gestational sac you have the embryo and the amniotic cavity and yolk sac. This is a monochorionic diamniotic with no septum between the 2. We have only the 2 amnion. And this is an old case because it's not so easy to have it early in the pregnancy. It was a monochorionic, monoamniotic twins with the 2 twins inside the same amniotic cavity. So what is the relationship between the yolk sac and amniotic cavity? This is a normal aspect. If you have 2 yolk sacs, that means you will have 2 amniotic cavity. And if you have only 1 yolk sac, that means you will have 1 amniotic cavity. But this is a normal. Sometimes you have some variant, but when you have this variant, the outcome is not good. Look at this. This was 2 amniotic cavities here, but only 1 single yolk sac, and with the death of the 2 embryo. 1 amniotic cavity here. The 2 embryo were dead inside, but you will see here 1 and 2. This is not normal. And the 3D rendering, and 1 was an embryo with acrania. Another case with 2 embryo in the same amniotic cavity, but when you move, you have 1 yolk sac here, and the other yolk sac was here, and with the death of the 2. Monochorionic, 1 is healthy. Monochorionic, diamniotic, 1 is healthy, but here you have another one, the amniotic cavity without heartbeat and the yolk sac. And this is a 3D rendering. But in such a case, you have to be careful of this one, to be aware of this one. This is another case. At 8 weeks of pregnancy, this was normal. This one was dead. Okay, was dead, no heartbeat. But if you use a color Doppler, you can see a flow inside. And it was a TRAP syndrome. It was a twin reverse arterial perfusion with a acardiac. This is a cardiac, and you can see the connection between the 2 cords. And this was a lady with holoprosencephaly at 8 weeks on the next pregnancy. And this is exactly the same, but at 11 weeks with this cardiac, but with movement of one leg, and the 3D rendering, and this connection, this abnormal connection, this abnormal perfusion to this cardiac from this fetus. Conjoined twins, really rare too, at 9 weeks of pregnancy. The two are inside the same amniotic cavity. And now I will finish to how to suspect that something will be wrong in the early stage of pregnancy. First, if you have an irregular or slow heart rate, like this, you are sure if you have this, the prognostic is really poor. Also, if you are not able to identify the normal brain cavities with irregular head, or if you have no division of the prosencephalon, you can do the diagnostic of acrania holoprosencephaly. Early hydrothorax, you can do nothing, only to do a checkup 1 week or 2 weeks later. Small gestational sac compared to the embryo. Here. You have no amniotic fluid around and no extraembryonic cellum. And also if the embryo is small compared to the gestational age. Because if it's small, like this, if you are sure of the beginning of the fertilization day, that means maybe it's a trisomy 13, 18, or triploidy. And look at this one. This one was at 10 weeks and 1 day, and it was a little bit too small because it's 9 weeks and 4 days. What was the problem? But it was no problem. It was not a problem. It was only because you have to use the correct chart, the correct growth chart, because it was a rhesus monkey, and it was not on the system. This is for human. And the size of the embryo is normal for this rhesus monkey. And here you can see I have this picture from Thomas Hildebrandt. And the embryo and fetus from lion, rhesus monkey, wallaby, elephant is nice one, pygmy, and Bengal cat. So thank you for your attention.